When it came to the, first of all, welcome, Mr. Secretary. When it came to the Caring for Our Veterans bill, we had consulted with the VSOs and in fact got support of 26 of the VSOs. We actually consulted with you and the VA to make sure this stuff would work. Members on this committee and members off this committee. And in your written testimony, you said the VA believes the future of community care should include 8 tenets. Those tenets are improve veterans' choice of community providers in meeting their health care needs, to simplify veterans' eligibility with a focus on veterans' clinical needs, to pave the way for consolidation of all community care programs, add convenient care benefits, set timely payment standards, include provider agreements with flexible payment rates that streamline how we pay for care, including care in state veterans' homes, permit medical record sharing in the network when needed for veterans care, and addresses clinical staffing shortages through expansion of graduate medical education and by improving VA hiring and retention of staff. I would just tell you that the Caring for Our Veterans Act checks every one of those boxes. And it checks every one of those boxes because when we drafted it, we had those tenets in mind. And so I would really look forward, and I look forward to a strong press release in support of this bill. And I'll tell you why, because there's a certain amount of frustration, as you can tell, with Senator Moran and the chairman, myself, and others on this committee that you've been silent. Okay? So thank you. Section 211 of the accountability requires the VA to track the usage of new authorities granted to you, and we've given you a lot of new authorities over the past year, thanks to the good work of the chairman. When will we see this report?
The report was due in December of 2017, so I apologize that it is not there. The staff has had extreme difficulty tracking what you've required in that report prior to the implementation of the Accountability Act.
So
I've instructed them to give whatever data they have to you and tell you what data they can't collect.
So when can we expect it?
I'm going to say, is it reasonable to ask for 2 weeks?
2 weeks it is. We'll hold you to it. Your predecessors have testified that leadership includes working with underperforming employees to make them better at their jobs rather than just firing them. Is that your philosophy too?
Yes, it is. That every good manager works with their employees to make them better, to give them feedback. When an employee deviates from a professional or moral standard, sometimes you can't coach them, sometimes you have to help them find the door.
Do you believe that your leadership is doing that in the VA?
Yep. Well, I think that we have room for improvement, because when you look at our employee engagement scores, they're not improving the way that I believe that they should, so we're re-looking at our efforts to do that better.
Okay. On the choice bill that was passed last August, Congress expanded your direct hiring authority for positions for which there was a shortage of highly qualified candidates. Am I correct that the VA is still not used this authority to hire?
Yeah. When you look at, my understanding, Senator, is that the direct hire authority was given to us for medical center directors and network directors.
Yes.
And I think unintentionally, it capped the salary that we're able to offer at a salary that is lower than what we currently offer. So we've not been able to utilize the direct hire authority in the way that I believe it was intended to be used.
So how can that be fixed?
It's a very small technical
Can
fix.
you do it by rule?
No, you're going to have to do it legislatively, but it's a very small technical change that we've given some technical advice on.
And it gave you authority on those positions, but it also gave you authority for employees that you would deem critical.
Yes, and we've gone to OPM with 15 different critical occupations that they have agreed to move forward with us on direct hire authority that I believe we will start to implement in the next several weeks.
So, okay, so we've had the conversation before. I had a town hall meeting in Great Falls, Montana, Monday. I will tell you the first question that came up was workforce vacancies. This is just Montana, so sorry about being self-centered on this. But I just want to tell you that we're in a crisis, and we may be in a crisis in Alaska, and we may be in a crisis in North Carolina and every other state too. I don't know that, but I can tell you in Montana, we're in a crisis. Let me give you an example. Billings. supposed to have 7 docs in that clinic. We've got 4, and 2 of those are looking for another position.
Yep.
When you overwork employees, they tend to hit the road.
Yep.
And so my question is what's the problem? I've talked to you many times. I know you're committed to this, but it seems like it's getting worse. In fact, it doesn't seem like it. In my state, it's getting worse.
Yeah. Well, in Montana, as you know, you have an 11.2% turnover rate of your employees, but for physicians, it's 23%. That's a problem. You have a 24% vacancy rate for practical
I've
nurses.
got all that.
So
So
here's
what can we do to fix it?
here's what
What are
we're-
you doing to fix it?
Here's what we're doing. First of all, we have to hire more staff, and we have to make sure that we keep them. We have announced for Montana a increase of up to $120,000 for primary care physicians in educational debt reduction.
Yes.
For nurses, for psychologists, and nurse practitioners, a $10,000 hiring bonus, and for social workers, a $5,000 hiring bonus. That's a beginning to start to address people to look at the VA as a place to come to work. Then we have to, as you said, if we can't fully staff, it puts more pressure on our current staff that are there, and so it's a vicious cycle. So we're working to recruit.
So thank you for that, but time is of the essence, and I don't speak for Senator Rounds, he'll speak for himself on this, but as you well know, there was a House bill that was gonna have a BRAC done. They could literally shut down damn near every facility in Montana if they did a BRAC, because we got no staffing.
Right.
This is really, really, really important.
It is. It is. It is.
Thank you, Mr. Chairman.
Absolutely.